having the first round of extensive talks on more than 300 revisions suggested by nations to this internationally agreed-upon legislation, governments came to an agreement on how to move forward with the process of amending the WHO International Health Regulations 2005, IHR. The IHR established agreed-upon strategies and requirements for nations to fulfill in order to prepare for and respond to disease outbreaks and other severe threats to public health. The COVID-19 pandemic has given rise to a number of issues, which have been addressed by the proposed changes. From the 20th to the 24th of February, the Working Group on Changes to the International Health Rules, 2005, held their second meeting. At this meeting, the proposed revisions were considered for the very first time. The panel discussed each of the 307 suggested modifications after hearing the rationale behind each one from the various countries. They also reached an agreement on the following actions to take in order to engage in more in-depth talks on the proposed revisions, as well as arrangements for its subsequent meeting, which will take place between April 17 and April 20. Dr. Ashley Bloomfield, who is the co-chair of the IHR Working Group, stated that when debating revisions to the rules, nations focused on making their country and the international community better prepared for future catastrophes. COVID-19 showed us that having a good, strong set of international health regulations is essential, and showed where the current regulations need to be improved, said Dr. Bloomfield, who served as the former Director General of Health for New Zealand. COVID-19 showed us that having a good, strong set of international health regulations is essential. In order to make the world a safer place and combat the current epidemic, it is essential for nations to cooperate with one another and provide their assistance to the World Health Organization, WHO, in its mission-critical job. The manner in which the conversations were held and the advancements that were achieved during the conference this week make it abundantly evident that the nations appreciate the duty that falls on their shoulders to guarantee the success of this process. Throughout the course of the meeting, which lasted for a week, the 194 member states of WHO, all of which are also state parties to the IHR, emphasized how important it is to strengthen capacity building, particularly in low-income countries, access to benefits arising from sharing pathogens, equitable access to medical countermeasures, and increased cooperation and information sharing. Dr. Abdullah M. Asiri, Deputy Minister of Health for the Kingdom of Saudi Arabia, and a fellow member of the IHR Working Group co-chairs, stated that governments were dedicated to leading the process of improving the IHR, which would, in turn, make the world safer and healthier. According to Dr. Asiri, countries are in the driver's seat of this process because they are responsible for implementing the international health regulations, delivering on their responsibilities, and making the crucial decisions needed to respond to risks to public health. During the epidemic, the world was confronted with the urgent need for functional international tools, and it put an increasing priority in international institutions such as the WHO. Rules that have been updated will make it possible for the globe to improve its ability to detect epidemics early on and stop them from becoming major public health crises that require worldwide attention. The purpose of this is to improve everyone's safety by bolstering our collective ability to do that. In the time leading up to the summit, an impartial and multidisciplinary group of specialists developed a technical assessment of the revisions that were being presented in order to provide nations with assistance in their talks. In the meantime, nations are also debating the development of a WHO instrument on pandemic prevention, readiness, and response, which is also known as a pandemic agreement. These negotiations are taking place concurrently with the process of amending the IHR. The zero draft of the treaty will be discussed during a meeting of governments that will take place from February 27 to March 3, 2023. Dr. Bloomfield believes that the two processes are complementary to one another because they are both driven by the need of making the world safer from communicable diseases and providing fair responses to public health risks. The efforts to update the international health regulations and draft a pandemic accord share a number of common themes, including the importance of equity in access to health, collaboration, and capacity building, he said. His efforts share a number of common themes, including the importance of equity in access to health. It is essential that there be coherence and harmony between the two processes, the speaker said. The international sanitary rules were first published in 1951 by WHO member states. These regulations served as the foundation for the international health regulations, which were formally established in 2005. The IHR are a document of international law that imposes obligatory legal obligations on all 196 states that are parties to them, including all 194 states that are members of the WHO. The IHR provide countries with both rights and duties, one of which is the mandate to report to the WHO any incidents of public health that pose a threat of being transmitted internationally. They also outline the criteria for determining whether or not a particular event constitutes a public health emergency of international concern, which is the highest level of alarm under the IHR for the WHO. This, in turn, triggers specific response actions for countries to prevent the further spread of the epidemics and reduce their impact on population health and societies as a whole.